Welcome to the Rich Feet Podcast with Dr. Tanisha Richmond. This podcast is sponsored by the Richmond Foot and Ankle Clinic, where they specialize in happy feet. Each episode highlights the best of Dr. Richmond's radio show, providing bite-sized clips of advice. Let's jump right into the show.
Good afternoon.
And how is Dr. Tanisha Richmond today?
I am holding on.
That is awesome. Loving the shirt. For those of you that are Facebook Live, that sweatshirt is killing
Yes, Colorado. Getting ready for tonight. Got all my fingers and toes crossed.
Hoping for the best.
Yes, we're going to keep hope alive.
That's right. So tell us a little bit about what you've been doing the past 30 days, Doc.
Well, I've read a couple books. I'm finishing Stacey Abrams' second book, Rogue Justice. She is a phenomenal writer. She's probably the Toni Morrison of legal book writing. Her writing is so intense and analytical. She really takes you on a deep dive of law and her mind. She has a very deep mind. And actually, I listened to part of Bill Walsh. The score takes care of itself. He was the coach for the San Francisco 49ers. I actually listened to him after listening to an interview from Deion Sanders for some of the coaches that he followed. So I said, let me follow the coaches who coached Deion to see what they taught him. And then I read The Entrepreneur Revolution. Trying to find that one. And that's just about being an entrepreneur, what it takes, more the reality of entrepreneurship. A lot of people have delusion that they're going to decide they're going to start a business. They're going to be filthy rich in a few months without any hard work, blood, sweat, or tears. And this book taught me, the process, and it gave a very realistic view of entrepreneurship. And then also I set up a Amazon affiliate marketing page with Amazon, so now I have my own store.
So wait a minute, guys. At first, they were able to go into the actual doctor's office to get their items. So now they can shop online?
Yeah, if you go to, I think it's affiliate marketing on Amazon and search stores, it's Tanisha Richmond, DPM. And it's just different products, like things for diabetic shoes, wart treatments, night splints, which are used for stretching for plantar fasciitis, orthotics, corn and cushion pads. I have some of the books I've read in there. Still working on it. A patient showed me, and I went to the wonderful world of YouTube University.
And congratulations, you graduated.
No, I'm still working on several degrees from YouTube University.
Right.
And I watched several videos.
But it was helpful.
Yes, it was helpful. But then actually, if you go on Amazon, they have videos showing you how to do it. And then I actually reached out to Amazon because I was trying to merge my Audible book list with the book list there. And they sent me more videos. So just a little project I was working on. When we endorse so many different products and things that we use and what we like, it's always good to get some kind of reimbursement for your advice.
That is awesome. So you've added that to a plethora of things that you can. And while you talked about adding affiliated marketing on Amazon, share some of your other platforms.
So I'm currently on Spotify, Apple Podcasts, most of the podcast channels. I have a podcast. It's called Rich Feet Podcast. It is actually a tape of this radio show that is put on the podcast. So if you missed some of the shows here, I think it's probably from the last 2 years, probably, of all the shows that are on the podcast. And then, at my office, I have the Foot Boutique. So we have the diabetic socks, diabetic compression socks. We do diabetic shoes, which are covered for most insurances for diabetics only. Diabetics only qualify for diabetic shoes. You can qualify for orthopedic shoes if you have major foot deformities, like if you had severe, maybe hammer toes, bunions, you're born with a foot deformity, or you acquired a foot deformity, like from, say, severe rheumatoid arthritis or some kind of injury or trauma, something like that. We have antifungal toenail polish, so you can paint your nails, treat your fungus. We have toenail fungus polish medicine. We have medicated foot soaks that you can buy to soak your feet at home. We have creams, we got lotions, we got wart creams. We also have a diabetic-friendly foot spa it's currently down to 1 day a week. Currently looking for someone to help out with that as well. We have x-ray on site. We have vascular studies on site, neuropathy treatment, tendonitis treatments on site as well. So we're open Monday through Friday, 9 to 5. We close from 12 to 1 every day. We accept pretty much every insurance except for, I think, the Anthem Medicare and private Anthems and some of the Humana plans. And there is open enrollment right now. So if you do not hear your plan or you call and find out we are not on your plan, open enrollment is going on right now as well. And we also can help you with that as well. If you need someone to explain all the different plans to you in the state of Ohio with Medicare, we can help you with that as well. So we offer quite a bit down in my practice.
That is awesome. And so this season is getting into, of course, the fall season. We're in the midst of it, and the winter is just around the corner. What are some of the different concerns of patients that you're seeing that come to your office during this time?
Mostly dry skin. Dry skin, as we start getting hotter inside our houses, we're going to start drying out. So we're getting more dry skin, more cracked skin. I'm seeing a lot of interdigital tinea, which is athlete's foot between the toes. Like the last web space, it gets all white and icky, and sometimes it turns green and stinks. I think I have like 5 patients with severe interdigital tinea. They have been on antibiotics, antifungals, topicals. They've been cultured. I've used agents like alginate, which have helped dry it out. So I've referred, I think, all of them now for surgery, because I think it is a physical problem where the toe has to be what we call derotated to open up that web space so it can just dry out naturally. So we're also, like I said before, we're in a manufacturing town. So people may be getting more hours in, getting ready for the holiday season. So we're going to see an increase in heel pain, Achilles tendonitis, arch pain, some probably neuropathy pain. A lot of people have back injuries or back arthritis, bulging disc, pinched disc. So they may be experiencing numbness, tingling. And a way I always tell a patient the difference between neuropathy from diabetes versus neuropathy from a back problem is a back problem neuropathy will be my right fifth toe is numb. That's very distinct. So that tells me it's most likely coming from your back. But if you tell me my feet just burn and tingle, my whole feet, my hands, my feet, then that tells me it's more diabetic neuropathy. And then also your history. Are you a diabetic, or have you had chemo, or had you had problems with your thyroid, or are you HIV positive, or are you a heavy alcoholic? So those are other risk factors for generalized neuropathy. So that helps me a lot when a patient will tell me, or just say my right foot is numb. I always ask, what's wrong with your back? And usually it's something wrong with their lower back.
So here lately, we know that you attend frequently different conferences and expos. So tell us, in the last 30 days, have you gone to any of those, or any information that's new that you can share with our listeners?
There's a new bunion procedure out. It's called a 3D Lapidus procedure, and it still is surgery. You still have to be put to sleep, but they're using different types of hardware to actually rotate your first metatarsal bone, and then they hold it in place with screws and plates to fix bunion procedures. And it's still surgery because a lot of people are on this laser They want to know about this laser surgery and things like this. I'm not aware of anyone currently using lasers in Dayton, but realistically, most bunion surgery, you're going to be down 4 to 6 weeks for bunion surgery or any kind of bone surgery, period, because bone does take 4 to 6 weeks to heal. So I always have a discussion about that with patients. They're doing clinical trials at the Midwest Clinical Center over at St. Elizabeth for bunion surgery as well. So if you're interested in getting your bunions fixed as well as being paid, I think like $1,300, that's a possibility as well. But of course they want, healthy clients, healthy patients with not many pre-existing conditions. So if you do have some bunions and you do have time to have them fixed, that is another option as well to get your bunions fixed.
And how difficult is it to get your bunions fixed?
Well, most of it's the rehab after the surgery, because a lot of people think it's like getting their teeth pulled, and it's major surgery. You are down, like I said, 4 to 6 weeks, non-weight bearing to that foot. You might be in a boot, but you're pretty much non-weight bearing for 4 to 6 weeks. You're on pain medication. You're seeing your doctor probably, if not every week, every 2 weeks until you completely heal. And it's not a simple surgery. So don't equate that with, like I said, getting your teeth pulled where you can go back to work on Monday. No. You'll be off for a few weeks unless you work somewhere where you can sit down, and then you possibly could go back maybe in a week or so.
So it's a process to that.
Yes, it's a process. You will never ever see a doctor and have surgery on the same day. No.
So why is that?
Because you have to see the doctor. You have to be examined, x-rays. They have to discuss the surgery with you, get consent, and then the surgery has to be scheduled at the hospital, which, depending on the surgery schedule, could be a week to a couple weeks out. So never plan for surgery on the same day for bunion surgery. Now, if you're going to get like a nail avulsion, yes, same day, or wound care, something like that, or a skin biopsy, something minor, but no bone surgery same day. We always have to reschedule that on our surgery days, or if you go into the hospital, you have to work with the hospital to get your surgery scheduled.
So there's a process to everything, and I know I looked at some of the questions that came in prior to you coming, and some of the people really just wanted to know, what about the sharp pains they're feeling? There's a couple of questions about sharp pains, particularly in their feet, and there were questions about which shoes are the best shoes to wear when you're standing up a lot.
I would say more like tennis shoes with a nice thick sole. I mean, if you have to wear boots, wear your boots. But then mainly what it is what you put inside your shoes. Like all my shoes have orthotics in them because I am extremely flat-footed. So I need support to my arch. So I would say it's not necessarily the shoe, it's what you put in it. Now, but of course, if you're in a job where you're like a nurse or you're working in a factory, you're standing, you need something with a nice thick sole on it, something kind of flexible. But then you also need a good pair of orthotics in your shoes. We actually sell medical grade orthotics in our office that are $40 a pair. We can always send you out for customs, which are like $400. And of course, if you go to that place you see on TV, I think those are $1,000. So I would say start off with mine. If they don't work, then we can go take it up to the next level. But most people get good relief with the medical grade orthotics that I have in my office. And you can just purchase those. We do recommend that you're fitted in your shoes to make sure they actually fit because they go by your shoe size. But if you're standing all the time, that's the main thing I would suggest.
Interesting. And so for those that thinks that it's one size fits all, can you kind of explain that? Like, this is the system for everyone and not so much.
What do you mean as far as the orthotics?
Yes.
It just goes off your shoe size. So basically we just ask the person their shoe size. They have to be fitted in tennis shoes because generally they won't fit in dress shoes. They may fit in some of those Crocs and the ugly Wheezy shoes. They fit in those. But they may slide around. but we really would like for you to present in a pair of tennis shoes. And we're going to take out the original insert and put ours in there, have you walk in it, let us know how it feels. And then you can move that orthotic from shoe to shoe. You don't wash it because it will fall apart, but you can spray them with Lysol, put some powder on them to keep them fresh. And most plans, well, Medicaid plans pay for one pair a year. But of course, if you want more, you can just purchase more if you have multiple pairs of shoes. And then we also have some little steps left, which are for infants probably up to, I would say, elementary, because children's feet now are grown feet sizes. We have little step orthotics as well in our office. And we also have, I forgot the brand of it, it's another brand of orthotics we have in the office as well. So if you're having arch pain, specifically heel pain, always come in tennis shoes or bring a pair of tennis shoes with you to the visit.
So if that heel pain is that bad for you and it's okay to wrap it, or do you suggest not to wrap it like in a mainstay?
You can try different things. The mainstay of treatment is first the orthotics. We give you stretching exercises. Now, if you want the pain to go away instantly, that's the injection. That's when we inject exactly where the pain is with the lidocaine and steroid right into the heel. We can also do a strapping, and that's where we tape up your ankle like you see the athletes are all taped up. If your insurance covers, we can dispense you a night splint. That's where you wear it while you watch TV, and that actually gives you a passive stretch of your tissue of your foot, your Achilles, your quads. And then we can also send you out for physical therapy where they can stretch you and do different things to you to help with your heel pain as well. So there's a lot of different options. I don't know necessarily if an ACE bandage would help. I mean, it may help. You could always try it. It won't hurt. But I would suggest more ACE bandage, more like for an ankle sprain or maybe trying to get down some swelling in your foot or something like that.
Interesting. And there was another listener that wanted to know a little bit about plantar
fasciitis.
Yes.
That's the same thing as heel pain.
Okay, same thing.
That's the medical term.
Okay.
Same thing as heel pain, heel spurs. All that's the same thing.
And how do you heal the heel spurs? How do they get healed?
They don't get healed. The only way you can get rid of a heel spur is surgery. And they have to physically go in and cut the spur off, or they can rasp it off. But generally, I tell patients that's not really the cause, because when you grow a spur in that area right on your heel bone, it just tells us that the tissue's been inflamed long enough that the body just grew a little spur. So most of the time, that is not the problem. But sometimes it can be if it's on the back of the heel, and we call those pump bumps, where people have excess bone on the back of the heel by their Achilles tendon where it inserts and is rubbing their shoes. Now, sometimes in those cases, they may have to have that removed, but that is major surgery because they have to detach the Achilles, cut the spur, reattach the Achilles tendon. So that's a while for recovery. But most patients with that, I'll just tell them try to wear backless shoes so it doesn't rub them. Or we can put some kind of padding in the shoe so it doesn't irritate that area.
And what were some of the other problems or concerns you've seen from patients here recently besides heel pain?
Diabetic foot ulcers. If you are on dialysis, you should be seeing a podiatrist at least once a year, probably 3 times a year. Patients who are on dialysis are end stage. So that means they're end stage renal disease, which means they've had renal disease for a long time to the point that their kidneys no longer work. So lots of time they also have complications from diabetes as well. Because actually I saw a patient this week. He had one limb. He was on dialysis. His one limb that remained was jet black. And I want to say he was caramel up top. Luckily, he is senior vascular specialist, but, the coloration of his skin and lack of pulses and hair is scary for a podiatrist. So if you are on dialysis, you should be seeing a podiatrist. I want to call us foot fairies. your fairy foot mother. Because we're just around to hover over you, to make sure everything's okay. If we see something going bad or wrong, we can get you on medications. If we see things that worry us, especially like if your vascular status is looking concerning to us, changes in your skin color specific digits, like one toe is turning black or turning a different color, that's showing us that you have decreased blood flow. So we'll know for sure that we need to get you to a vascular specialist. Or if you have infections, we know we need to get you on antibiotics and talk to your doctor, especially if you're on dialysis, if it has to be renally adjusted or adjusted based on your kidney function. All right, well, thank you so much, Dr. Johnson, for calling in. And let's see, next month we will be in November, so we'll probably have to get with you. Yeah, we have to get with you. Well, it won't be the week of Thanksgiving, so it'll probably be the weekend. Well, it may not be that weekend either. I have an event already scheduled, maybe the second weekend in November. We'll do the next book club, but we'll get you those dates.
Interesting. So it's nice to hear all the different books that you all are reading, and it looks like if we're looking at the second Saturday, that's Veterans Day. So
yeah, because the third Saturday is Indulge, so I will be a vendor at that event, and then the weekend after that, I will be home.
Speaking of events, and when you set up at different tables, share with our listeners what you like to have on your tables and what's mostly observed and purchased when you set up.
Well, I just did trunk or treat last night in Trotwood. So the only thing on my table was candy and a couple cards. And I did a men's health fair. Can't think of the name of the church, but it's the church on Siebenthaler that used to be the old movie theater. I spoke at there last weekend for men's health fair. It was a men's health fair, so I just talked about the diabetic foot and ways to take care of your foot and protect and save your feet. Most of them on all my tables is information just on diabetic foot care. I'm also a board member as well for Diabetes Dayton, which is on Southmore Circle down on the same street that runs beside the Walmart Moraine. And actually we have a run walk coming up on November 4th, I want to say, and that's going to be at the old NCR building campus, actually across from Carillon Park. And I think that's going to be from 8 to 12. There's a run and walk first. And then right after will be a health fair with free health screenings and blood pressures, blood sugars. I will be there doing foot screenings as well. And so on my tables, I'll put out information about gout. I actually have a little display showing what a gouty joint looks like. I put out some of my diabetic shoes so people know they're not ugly and look like Frankenstein shoes anymore. All kind of information, heel pain, pediatric problems, flat foot pain, arch pain, ingrowns, warts, calluses, different things, gout information. So, or I'm just there answering questions of people who may have foot and ankle questions or concerns or trying to find a new podiatrist. I know a couple of locations around the city have closed recently, so I am accepting new patients. We're usually, right now, probably a week to 2 weeks out, just depending if you want morning versus afternoon appointments. Most of our mornings are full. So if you can come in the afternoons, we can probably get you in sooner.
Interesting. We know that this is a very busy season for many during this time of year, and you travel quite a bit, and understandably so because you do go home. So share with our listeners some of the best practices that they can do during the season.
Watch your diet, especially if you're diabetic. This is the hardest part of the year for us because I'm diabetic as well. And don't be afraid to let people know you're diabetic. Don't be afraid to explore diet options where you can use Splenda versus sugar. Try it out because I bake with Splenda. I actually make sweet potato pie with Splenda. And it tastes the same. No one knows the difference. But try different things. Plan ahead. Let people know you're diabetic. And I always tell people, just go wild on protein. So if you're at Thanksgiving dinner, You want to be eating like the turkey, all the vegetables you want. You want to stay away from your carbs, but you want to fill your plate up more with your turkey, your greens, your green beans, maybe your green bean casserole, but then a smaller portion of like your macaroni and cheese or your dressing and your carbs. And then, of course, with us, we are like crackheads when it comes to sweets. So it's better for you to get a sliver of that pie, a sliver, not a slice, a sliver, so you can get your taste and get your hit. Because usually that's all it takes. You just got to get the taste. Once you get the taste, you're okay. But if you just sit there and stare at the pie without tasting, it could be traumatic. So just get you a sliver or get you a slice and work on that slice for a day.
Now,
Take a little bite here and there.
Well, wait a minute, Doc. Is it more in the eyes or is it more in the tasting of the food in the head?
It's all of it. It's because they tell us we can't have it. So we want it even more. Like today, my power went out in Clayton. As soon as the power went out, I wanted to cook. Then I realized my whole kitchen is electric. But I wasn't hungry till I couldn't use my kitchen. And then, eventually power came back on. It's a mind game. And being a diabetic, you have to accept your limitations, but you also have to learn how to move, which is protein, macoon, and sweet potatoes, which are protein and a good potato. But, they won't notice that I'm not eating that red velvet cake over there. Or I have a little piece of red velvet cake. And then instead of I'm not drinking that sweet tea. They have made me some sugar-free tea, or I have gotten a sugar-free drink or water so I can accommodate myself. And then once you become, I guess, more realistic diabetic, people will appreciate it. And they'll do things for you. Like my mom's boyfriend, he makes sugar-free lemonade. And he always labels it, so we know which one is which. So we know which one to stay away from. So, but it's talking to your family and letting your family know what you can and cannot do. And especially the bakers, talk to them and ask them, can you try to do this with Splenda and see how it tastes? And they can do one that's sugar-free and they can do one that's regular for you.
When you mentioned Dr. Richmond, which I think is wonderful that you can open up, because some people really can. So talk to the listeners a little bit about how important it is to open up and share your health struggles, your health challenges, so that they are aware of what you're dealing with, because sometimes people don't know.
Well, I got a couple of problems. So I've been a diabetic now 22 years. Yeah, because I was diagnosed in medical school during my second semester of medical school. I was studying during finals, and my last final was physiology. And I realized I was a diabetic. I was actually in DKA, which is diabetic ketoacidosis, which means my sugar had gotten so high that my pancreas had stopped working and my body was breaking down muscle and fat to survive. And the byproduct of that is acid, and it raises in your bloodstream. And if it gets too high, it can kill you. And that's when you hear about people going into a coma, a diabetic coma. So you can go into one for being too high or too low. The most dangerous one is to be too low, because last time if you go too low, you can't recover. Blood sugars in the 20s to 30s, the brain just shuts off and it can't recover without sugar. But it can stay alive with too much sugar in most cases. And then in 15, I was diagnosed with MS, muscular sclerosis. So I've had MS now 7 years. I would say I'm very blessed and highly favored because I was diagnosed within 3 months. And my best friend at the time is an MS specialist. She's an African-American female who was training at Wright State in her residency because her brother died from MS. And she has been on the journey with me for the last 7 years. And she actually made me switch to her attending at University of Cincinnati. And I've been on some of the strongest and best medications. And I've only had one relapse since I've been diagnosed. And lots of time I forget I have it until people bring it up, which is a blessing in itself. And I want to thank Obama because I am on Obamacare. and that insurance does pay for my meds and all my treatments. And I'm very thankful for that because I've always been a proponent of the Affordable Care Act because I have been on it since it started, I want to say in 2010, because I had pre-existing diabetes at the time.
That's great, and it's wonderful, Dr. Richmond, that you can share your story and be so transparent with others because it does help. I'm sure it helps your patients to open up and feel like they can share with you because you're so open with your life and your experiences, and I'm sure it encourages them.
Yes, I think it does, because especially with the MS side, I see patients in all different stages of MS, and a lot of people don't understand, the faster you are diagnosed, the faster you start taking medication will pretty much give you the planning of the rest of your life. So if you are having symptoms, like my first symptom was my whole right side of my body went numb, but some people lose vision, some people start falling, walking into walls, dizziness, bladder issues. I mean, it presents in so many different ways. But, at your first symptom, start getting it worked up to figure out what it is, because the faster you are on medications, the better your quality of life will be. And, there are side effects, but there's side effects to every drug. But in the case of my MS meds, I knew the side effect of not taking a drug, which could have been not working, not being able to pay my bills, not walking, not controlling my bowels, not controlling my life. So I took the risk, and I'm very thankful that I listened to my colleague and friend, Dr. Shannon Seals. She is a neurologist down in New Orleans. So there are options, if you have MS and you want to talk about it, you can always schedule an appointment, we can talk. I can actually refer you. I have referred a ton of my patients to my attending and to UC, because they actually have their own Neuroscience Institute facility now down at the main campus for everything you could ever want or need with a neurological disease.
That is fantastic, Dr. Richmond, and I know that we had a couple questions come in wanting to know how to connect to your podcast. Will you share?
So if you go to Spotify and you search Rich Feet Podcast, or maybe Tanisha Richmond, but I think it's Rich Feet Podcast, you can search it and then you can click follow, and then you'll be able to see all the different podcasts, and you should get an alert when there's new podcasts out there.
Okay, great. Hopefully that helped you, our listener. Thank you for your question. And so you have some of the insurances that you accept. That was a question, and I know you got many that you do it. Some people just want you to kind of share. So can you share with our listeners some of the insurances that you accept?
Okay, so I'm on Aetna, Medicare, Medicaid, Workman's Comp, Medical Mutual, Cigna, TRICARE, Standard, Prime, Humana, PPO, not Humana, HMO. I'm on Molina, Medicare, Medicaid, Multiplan, UHC, Medicare, Medicaid, Buckeye, Medicare, Medicaid, Paramount, CareSource, Champ VA, and there's a couple new Medicaid plans. I'm on Anthem Medicaid, Humana Medicaid, I think it's AmeriHealth or Ameritas Medicaid, and I'm getting credentialed on this. It's a new Medicare plan that just came out, and I'm in the process of getting credentialed with that. The best option for you to do is to call 937-228-3668 or text 937-228-3668, where you can just ask, I have this insurance, is she on this particular insurance?
And of course, we know that you are a local podiatrist and foot specialist, but can you tell us some of the special things that you specialize in?
Just basically foot and ankle.
Sprains.
And anything you can do to your foot, I can fix it. And if I can't fix it, I can get you to someone who can. So, I'm dealing with the skin. I deal with all aspects of the foot and ankle. So I'm looking at your skin. So if you have eczema, psoriasis, rashes, scratches, bites, animal bites, bug bites, I can address that. If it's something that I've never seen before, I need to Google or research, I can always do what's called skin biopsies, where take some shavings of the skin, send it off to a lab. We can culture your skin. If I see or smell something I'm not used to, or I want to make sure we are covering everything that's living on your foot, I can do like a biopsy or culture of the wound and send that off. As far as the musculoskeletal, any kind of sprain, strain, fracture, tendonitis, pain, we can address. Now, if it is an acute fracture, depending on if it's displaced or non-displaced, then that's a different issue or a different discussion as far as surgery versus not surgery. Or do you want to see someone for surgery, or do you want to let it heal on its own? So it's all kind of different options out there for that as well. And then, with all the different health problems with the diabetic foot, the venous stasis legs, with the big swollen legs with venous stasis, and lymphedema, lipedema, which is excess fat in the legs and arms, and then all the general aging issues. So your toenail fungus, your dry skin changes, skin growths, skin textures. So, pretty much I've seen, smell, heard it all. And if I don't know, I can go to Dr. Google or now AI, because now you can plug things into AI and it will give you a whole essay on anything you want to learn about.
And of course, we know that you are a true fan of the Saints and
now Colorado.
So on a lighter note, we're going to take a short break and come back and talk a little bit about the sweatshirt you're wearing, the game tonight, and the next time that the Saints play. So, well, Dr. Richmond, thank you so very much. Your final comments.
Take care of your feet. You only have two.
We hope you enjoyed today's show with Dr. Richmond, sponsored by the Richmond Foot and Ankle Clinic. The clinic is located at 1323 West 3rd Street in Dayton, Ohio. Zip code 45402. To book an appointment, call 937-228-3668, or you can learn more at richfeet.org.